year, about 9 million people throughout the world become sick with TB. Not just infected with TB, they become sick with TB. Of those 9 million, only 2/3 are treated for TB. And of the 2/3 that get treated, only half of them are successfully cured. So we have to find those missing millions, those that are neither treated or diagnosed. And the reason for that is for every person that is sick with TB, they have the potential to infect 5 to 8 other people.
TB is a strange disease. It's insidious in onset. It starts off very slowly with people thinking that they've just got a flu, just a bit of a cough. And by the time that they present to the healthcare system, they often are quite ill.
More than 10 million people develop TB every year. In South Africa, almost 500,000 people are diagnosed with TB every year, which is an incredibly high number, and I think just such a large problem that we need to put more resources, we need to put more collaboration, we need to work together to tackle this problem.
The bulk of the missing cases, I feel, are found in the community. They're living in the community, and particularly in the peri-urban areas, and particularly the informal settlements, the slums and the shanty towns. That's where these missing cases are found. Until recently, we didn't have very good tools to find the missing cases. Now we have molecular tools like Gene Expert Ultra. We have the urine lamb tests, which works well in certain subpopulations, for example, advanced HIV. So there are some tools now that we can leverage to find these missing cases.
Would it be possible to enable patients to go after hours? I know for myself, I would rather go to the doctor after finishing my day's work than go before and miss a day's work. So for many people, that's a loss of a day's salary. So maybe they would rather want to do the work for the day, coughing, etc., and then being able to go safely to a community clinic to get diagnosed.
So the disadvantage of them being quite ill is that they potentially have mortality, they can potentially die, but in that period of time when they are not diagnosed, they are also spreading TB. And that period of time in an HIV non-infected patient is between 4 to 6 months, that they're out in the community being sick and spreading TB. So what we need to do first of all is we need to raise awareness of the signs and symptoms of TB. And the second thing we need to do is we need to get a very good diagnostic, that we can find it early on in the disease process. And the Department of Health has introduced a very good diagnostic called the Gene Expert. So we can find TB very, very early on, probably weeks, maybe even months earlier than we could by other diagnostics.
So contrary to the popular belief that we have to find the missing millions, a lot of research has already been done to show that those missing millions, not just in South Africa, but throughout the world, are coming to healthcare workers. And it's healthcare workers that are not responding appropriately to these patients. And everything that I'm going to say to you is actually supported by research that has already been done and already been published. Patients that were presenting to the clinic, some patients were coming to the clinic and saying, I have cough, fever, night sweats, loss of weight. So they were basically coming and saying, I have TB. In that cohort of patients, 60% of those patients were missed. The healthcare workers either didn't collect sputum from them, or they did collect sputum and the sputum results went missing. That whilst there are many other studies that say we should go out and find the missing millions, which is far more expensive, these are patients that are coming to healthcare workers and saying pretty much, I have TB. And healthcare workers are missing the opportunity to diagnose them. There's a lot of research that has been done on the bug, the TB bug. There's a lot of research that has been done on the drugs, but there's very little research that has been done on the most important person. And that most important person is the TB patient. It's been described as a big black hole. Where researchers need to focus is on behavioral research and what it is that patients want. What are the patient's needs? Why do patients not complete their treatment? Why do patients not access healthcare facilities quickly enough? Is it because the whole healthcare environment, especially in the public sector, is unfriendly? It's not patient-friendly? When you're well, you do not want to go to a public health facility. Can you imagine when you're ill and you have to spend long hours in the queues waiting for care? And when you go to a facility and say, I have TB, you're not tested, you don't get your results. There just hasn't been enough behavioral research on what it is that patients want. We need to focus in terms of research on patient-centered care, qualitative research, behavioral research, trying to understand patients, trying to understand healthcare workers and what would motivate them to adhere to treatment. And with the NTB strategy of 1990, most low-income countries, particularly South Africa and India, have the willpower, they have the political will to make the TB control programs succeed. We need healthcare workers on the ground to really come to the party.